had a lot of problems, drugs and alcohol. And Betty Ford Center, it was the best. I heard it was the best, and it was where I needed to go.
Mrs. Ford and Leonard Firestone had a vision to create a treatment facility like no other, one that would help heal families, not just an individual, not just a piece of the family, but the entire family. High quality of care was very important to Mrs. Ford, and from the very beginning she insisted on quality staff, quality facilities, and quality treatment for the patients that we serve here. And we do have a chemical dependency recovery hospital license, which is one of very few in the state of California. In addition to that, the Betty Ford Center is also accredited with the Joint Commission. Betty Ford Center has a continuum of care that includes inpatient residential treatment, residential day treatment, and intensive outpatient treatment. Our inpatient treatment program takes place right here on our expansive, beautiful 20-acre campus located in Rancho Mirage, California. Our setting is very similar to a college campus in that we have 4 residential halls that are gender specific, 2 for men, 2 for women. And we also have a 5th hall that is dedicated to stabilization. And this hall is generally where detoxification and medical stabilization would occur with a patient before they're ready to participate in treatment. Our campus is a safe and secure environment, and all of the treatment services are within walking distance of the patient halls. A lot of patients find comfort in knowing that the detox is handled right here on our main campus, and there are medical services provided 24 hours a day, 7 days a week. Residential day treatment is located near the main campus in Rancho Mirage. Betty Ford Center owns a cul-de-sac of homes where the patients reside, and the treatment program takes place in private offices within about a 5-minute drive of the homes. We're fortunate to be able to provide one of the most intensive outpatient programs available to patients suffering from addiction. This special program is designed for patients who have commitments during the day, possibly working, taking care of a family, but are able to commit their time in the evenings for treatment. We provide a couple unique services here at the center for prevention and education. One is our family program, the other is our children's program. Both of these services are provided to the families of the patients we serve, but they're also open to the general public.
Part of what our admissions staff is trained and qualified to do is help patients and families remove barriers. Some of these barriers may be, I can't come to treatment because of my job, my family, because of finances. Admissions will help remove these barriers before they become consequences.
Within the first week of treatment, patients can expect to go through a thorough assessment with their individual counselor, as well as multiple members of the treatment team. And once that assessment is completed, it provides our treatment team with the information necessary to place the patient in the best level of care, as well as provide them with the best services in order to meet their needs.
If there was one thing in my life that's changed, I would say it was everything. And you know, I know that I never have to do it alone. And I know that there's people that have an honest concern for my well-being that will give me an honest answer about what I need to be doing.
Betty Ford Center maintains a connection with thousands of people from all over the world and provides services whenever they're needed.
What has kept me here is my fellow staff members. There is so much support and so much wonderful work that we do here. I love working with the patients, and I love watching my fellow staff members work with the patients as well. And the miracles that happen here every day are what keep me coming back.
I thought that my life was going to be over if I took drinking out of the equation, and that there would be no more light in my life. And I have found just the opposite. I have found a really joyous and happy life.
I think if you have a problem with drugs and alcohol, I think if you seek treatment and you stay with it, you don't give up, I think it's the best thing that could ever happen to anybody with a drug or alcohol problem, hands down.
It's a life-changing experience, and I'm grateful that I did it.
Whether you're seeking help for yourself or seeking help for a loved one, call our admissions department, and a qualified admissions counselor can walk you through the process and identify the best treatment options for you.